Ladies, have you been putting off going to the gynecologist because you're terrified of doctors and ever wondered what tests are done during a women's wellness exam? It's really not that bad, and it could also help you learn about your own body a lot more. I'm here today to feed your curiosity of all the tests that may or may not be done depending on your visit or medical issues that you discuss with your doctor. I know us human beings are quite curious creatures, and this information I'm about to give you will help educate women or men, because we do have men that like to be educated as well on what tests are done for each part of a woman's body. There are numerous tests that are done during this type of gynecological visit, but I'm going to only go over a few. For example, the Pap Test, cultures being tested, or the physical exam that is being done during this visit. One of the tests during the wellness exam is a Pap smear. Pap is short for Papa Nicolau. Pap smear is done through your cervix with a brush-like instrument that collects cells, and then it's mixed into a jar with a solution, and then is sent off to pathology. According to the page on Pap and HPV tests from womenshealth.gov, the test is done to check for any abnormal cells that may lead to cervical cancer. Normally, the Pap test is done on women ages 21 through 65 unless the patient is sexually active at a younger age. For a patient, if she has had a hysterectomy, she no longer needs a Pap smear. A hysterectomy is whenever your cervix is removed. So you don't have to worry about cervical cancer because you no longer have a cervix. Now that I've shared my knowledge on how a Pap smear is done, I'm going to explain on what else may be checked during a women's wellness exam. Another test that is done during this exam are cultures being tested. The cultures being tested during the exam may be tested for numerous things. For example, STDs, infections, diseases, and so on. According to Healthline.com, under the article Culture of the Endocervix, all women experience discharge, especially during their childbearing years. The main thing women need to look out for in their discharge is the color, odor, or any discomfort or irritation that they're having. When a woman states with the doctor that she's having any discomfort, the doctor will send her for any other culture tests to check for the infections. Testing the endocervical cultures may test for some diseases, and one of them is called the pelvic inflammatory disease, or PID for short. According to the MayoClinic.org, under the pelvic inflammatory disease article, PID is an infection of the female reproductive organs. It usually occurs when sexually transmitted bacteria spread from your vagina to your uterus, fallopian tubes, or ovaries. Some patients that have PID does not realize that they even have it because it often has little to no symptoms. There's another thing that I've explained that can be tested during a women's wellness visit. Let's move on to the last thing I want to inform you on that could be tested during the exam. Lastly, I want to talk to you about the physical exam that may be done. According to the article, What is a Breast Exam from PlannedParenthood.com, clinical breast examinations can detect a lump in your breast and other changes that may require more testing. When a lump is discovered in the patient is sent for further testing. One of the testing may be a breast ultrasound. If they see anything abnormal on the ultrasound, they could go in and perform a biopsy to test for anything that is cancerous cells. Another test that a doctor could send the patient for is a mammogram of the breast. There are two types of mammograms. There's a diagnostic mammogram and a screening mammogram. A screening mammogram is just a routine mammogram for patients that are 40 years or older. Diagnostic mammogram is a mammogram that is sent whenever they find any abnormalities in the patient's breast, like for example earlier, like I stated, with the breast ultrasound. If they do a biopsy and they see anything abnormal, they'll send them for a diagnostic mammogram. So in conclusion, my purpose today was to inform my audience on what kind of tests are done during a women's wellness exam. We discussed three main tests done during this exam, such as the Pap smear, cultures, and the breast exam. As women, we have the power to create life and need the knowledge of our own bodies. Having the knowledge of the tests done to our bodies and getting the results just lets us be assured that it's in perfect working condition.
Wait, can you cut that?